Congratulations! We have just placed an expander in your mouth. And you did an amazing job. Give yourself a big pat on the back. In a minute, we will be going over a few instructions for your parents and also for you to take care of this fancy gadget in your mouth. The fancy gadget that you are taking home today is going to expand the roof of your mouth in 4 to 6 weeks. Your gadget is going to remain in your mouth for a total of 4 to 10 months unless your orthodontist says otherwise. What to expect? During the first few days of expansion, expect some soreness from all of the teeth. The soreness will eventually go away, usually in 3 days or less. Also, a space between the two front teeth may develop within a few days of wearing the expander. The expander pushes the two halves of the jaw away from each other and the teeth follow. Do not worry about this because the space will close on its own. This is actually a sign of good progress. It takes about 4 weeks to fully close. One of the biggest challenges will come in the area of speech. Most find that they get used to speaking with the expander within a week or 2. If you read your homework aloud, you will get used to it very quickly. Eating might be a challenge initially. Give yourself a week to adjust, and during this time, eat small bites and soft food. Wink, wink, ask for ice cream, but not every day. Please keep your teeth, tongue, and expander clean. The expander may leave a temporary groove in your tongue, which, if not cleaned, could become infected. Daily cleaning of your tongue with a toothbrush will help you to avoid an infection. You also need to keep your expander clean since it is in contact with your teeth all day long. We will be providing you with a small brush that you can use to get into the nook and crannies of your expander, and don't forget to brush your teeth too. Listen up, parents. Here comes your part. While your child has a lot to get used to, you have your work cut out as well. You will be activating the expander every other night with the key provided, unless otherwise directed by your orthodontist. Ensure you have proper lighting when activating the appliance and position your child so you have the best visual of the hole to place your key. We recommend you do this heroic task at nighttime before bed. Things are a little more calm during this time for most families. You will need the key provided, and don't forget your child's mouth. Locate the hole in the center of the expander. It is easiest to have the patient lie down on a bed or couch where there is good light. Then, the patient tilts their head back so the expander can be seen clearly with the arrows pointing in the direction of the turn. Insert your key in that hole, noticing that the key has a curve to prevent the key from sliding completely through the hole. Make sure the key is firmly inserted into the top hole. Note that when the key is fully inserted, the bend in the center of the key is no longer visible. You will also notice an arrow on the expander. You will be turning the key in the direction of the arrow. Follow the arrows facing towards the back of the mouth to apply a small amount of pressure to swivel the key in their direction, completing a 90-degree turn on the key. As you turn, the fender rotates and a new hole becomes visible. The rotation stops when the key meets the back of the expander. When the turn is complete, simply push down toward the tongue while you continually to lightly apply pressure toward the back of the mouth to remove the key. You should then see the next hole for insertion at the top. Are there any precautions to take with an expander? There are certain foods that cannot be eaten while the expander is in place. These will include chewy, sticky sugary foods such as caramels, taffy, gummy bears, fruit roll-ups, Starburst, Skittles, etc. Sugarless gum is also okay to chew while the expander is in place. If I miss a turn, what should I do? Don't panic. Do the turn the next night and continue turning every other night. What problems can you have with an expander? The two most common problems that can arise when having an RPE is that food can become trapped between the expander and the roof of the mouth, or difficulty making the activation turn. When the expander is placed, we show you how to clean around it. However, if food does get stuck, you can swish or gargle with water or take a cotton swab and gently wipe the palate of the mouth. If discomfort continues, please contact the office. The other problem that can arise is not making a complete turn. Sometimes you think you made the complete turn and then remove the key. It appears as if the turn was completed successfully, but when you go to make another turn, the key will not go into the new hole. You will then have to return to the previous hole, which is located towards the back of the mouth, insert key, and complete the turn. You can also call our office and we can help. The expander may loosen in the back where the rings are. Your child will be the first to know this is happening. Please schedule an appointment to get this fixed. There are 2 flat arms that are resting on your child's teeth that we normally cover with a white filling materials. Sometimes the filling material will fall out. This is not an emergency, but please contact our office and we can fix it for you. Rarely, nosebleeds or headaches can occur. If they do, stop turning and call the office. Have fun watching your teeth move into alignment.